Okay, wonderful. Well, welcome everyone. It's a great pleasure to have you with us for this webinar celebrating the launch of USAID's updated Digital Health Policy Guidance, the Digital Health Position Paper 2024 to 2029. This policy document conveys a vision for a more equitable world in which people use digital technologies to access information and services to live healthier lives. We know this is a grand vision, and we know we can't do it alone. We appreciate your being here today as part of this conversation about how we can undertake this work collectively. My name is Adele Wagaman. I'm a Senior Digital Health Advisor in the Center for Innovation and Impact, or CII, in USAID's Bureau for Global Health. I'll be your MC for this event, helping to orient you to the various speakers and content we're excited to share with you over the next hour. But first, I want to help introduce you, the participants. Please use the chat feature of the platform. Tell us who you are, what you do, and where you're based. And as you're doing so, I'm going to share the lineup of USAID speakers I'm thrilled to have here with us today. First, we'll hear from Dr. Atul Gawande, probably somebody who doesn't need much introduction with this audience. He's a surgeon, author, and assistant administrator for global health at USAID, and he will be providing framing remarks. Then we'll hear from Merrick Schaefer, Office Director for CII, who will provide an overview of the Digital Health Position Paper. And then we'll hear from colleagues in our USAID Kenya and East Africa office, and then our USAID Indonesia office to share their experiences supporting those countries' health sector digital transformation journeys. And I'll introduce those speakers as we get closer to their presentations. So last but not least, over the course of this webinar, we want to have the chance to hear from you. Throughout this webinar, you are invited to ask questions in chat. We'll have members of the USAID team, including Amrit Sikkel in Washington, Nurul Ramanyati in Jakarta, and colleagues in Nairobi on hand to help answer these questions as they come in. We'll also be selecting some of these questions for a facilitated speaker Q&A at the close of the webinar as time allows. Some quick housekeeping notes before we dive in. First, this session is being hosted and recorded by our partners at TechChange. Thank you to TechChange. And they are using AI for note-taking. Your participation in this meeting indicates your consent. The webinar is being recorded and will be shared publicly following this session. And now to help frame today's webinar, it is my pleasure to turn the floor to Dr. Atul Gawande. Atul, over to you.
Thank you, Adele, and thank you everybody for joining. I'm Atul Gawande. I lead global health at the Bureau for Global Health at USAID. In 2020, USAID really transformed its guidance on digital health with what was called the USAID Digital Health Vision. And today, the Digital Health Position Paper that's being released updates that guidance for the next 5 years. That original vision, it's hard to underestimate the impact that it's had. It's transformed the way we have done our work at USAID in digital health, from building and deploying apps to deploying systems in which applications, telemedicine, analytics, even payment systems can sit in that system. One measure of what a transformation that has been is the flow of aid dollars that programs are choosing to put into digital health at USAID, which is now regularly every year in the 9-figure levels. Another indication is what we see it doing. I was in Kenya a few months ago looking at the primary healthcare advancements that have been made through our Primary Impact Initiative. And the opportunity that we were closely involved in is that the president had committed to paying 108,000 community health workers who had formerly been only volunteer, increasing their training, and critically enabling primary healthcare networks by getting the community health workers and the primary healthcare systems onto the same digital health tools, the electronic community health information systems. I really didn't see how transformative that was until I went and did the walk-arounds with a community health worker in her local community. She was seeing a pregnant woman, found that the pregnant woman had high blood pressure. As many of you know, high blood pressure is dangerous. It could be an indication of preeclampsia developing that untended becomes a source of maternal death. That she had her electronic system on her phone, was able to input the information for the person, was able to order a referral where that woman could go and get the issues addressed, and follow to see that order was actually followed through. Later in the day, when I actually visited that clinic, that mother was there, and the clinic was able to not only see that the referral had been ordered and why she was coming, because she may not necessarily be able to tell you exactly what was there, but actually have the blood pressure measurements and figure out what needed to be done. That's the smallest way in which we, through that kind of small way, you see the power of having not just an app, but a platform that enables it to work. The foundation of that approach is that the digital health vision and now the update call for countries to have a national digital health policy. That is, their approach should be defined for how they want to build their digital health systems. And I've come to think of the way that the vision and the update really put this forward as a kind of stack. That the tech stack enables, for example, that every person should have a digital ID, a way that you can find them and connect their data to that person, even if it's data coming from a blood pressure measurement here, a medicine prescription there. Second, it has to set up an information exchange that has clear standards for how information from different systems can talk to one another, so that that person's information can be connected. Oh, they had blood pressure elevation here, and they got the medicine that they ordered for them that can address it there. And then a provider should be able to access that information. It should be with security, it should be with privacy and control for people to determine who can have access. And then finally, it can even have a component that has finances, with payments being able to go on that system. People often will say, it's surely too expensive, it's too much. But that simple system is incredibly powerful. And with a national digital health leader overseeing its implementation, we've seen that it is extremely effective, cost-effective, and enables tremendous power from the systems that people create. You will hear from Kenya about the approaches that that they've taken in the digital space. You'll hear from Indonesia later, where this is a country that is an archipelago nation, 17,000 islands, 6,000 inhabited. And when I was in Indonesia, where USAID has supported the development of their national digital vision and some of the implementation as it's rolled out in primary health centers, I got to see some of the work we've supported where telemedicine was enabling nurses at the community level on islands across the country to access expertise when they see issues, to transmit information, and to seek and to order support. For example, being able to transport a woman off the island who had needs needing to be addressed at higher level centers. In Rwanda, there's a system I got to learn about that involved having a suite of connected digital health solutions for ordering, tracking, delivering, and then administering drugs. It had the ability for providers to see the national product catalog, put in orders, have logistics systems connected to it, supply management, so that their awareness of stockouts was greater, And you saw that they were able to reduce stockouts and address what is often a major gap for people. If you have the health workforce, if they don't have the medicines and tests they need, you can't get the impact that you're looking for. The update brings forward the work of the vision, what's been accomplished and what's been learned, and you will hear in the course of later presentations what is new coming in the update for the next 5 years. Among them is a recognition that artificial intelligence will play a greater and greater role in what we are doing. But it is just another version of a tool that may be very powerful. It's going to have limitations. It's going to have needs for governance. But above all, if it's not just going to be an isolated system sitting in a, it's going to need to fit into this larger digital platform. It's just another part of a country's digital health system, and capturing its power will depend on being able to offer that kind of system if AI is to have any impact. So with that, I just want to say congratulations to the team and all of those involved in putting the digital health position paper forward and laying out this vision for the next 5 years. Thank you.
Thank you so much, Atul. That was a wonderful walkthrough of the end-to-end value chain of possibilities that having a good strategic approach to digital health transformation can enable. So to walk us through what that looks like and how that's articulated in the digital health position paper, it's now my great pleasure to turn the floor to Merrick Schaefer. He's a longtime colleague and he's the Office Director for the Center for Innovation and Impact in the Global Health Bureau. And Merrick, the floor is yours.
Thanks so much, Adele. And thank you, Dr. Gawande, for your leadership and vision in advancing the use of digital health solutions to improve health outcomes. I'm so pleased to share that in September, we released a new policy document, the USAID Digital Health Position Paper, which replaces our digital health vision. I will spend the next few minutes sharing an overview of the priorities and practices in that policy that are intended to guide USAID's digital health investments in collaboration with our partner countries to enable more sustainable, interoperable systems that contribute towards stronger health systems and improved health outcomes. For context, when we use the term digital health, we're referring to the use of digital solutions in healthcare. There are many applications for individuals, healthcare workers, health system managers, and other actors. For individuals, it can promote the well-being and enable them to be more engaged in their care. For healthcare workers, it can help them get access to important information needed to provide informed, high-quality service delivery, as well as coordinate care with other providers. For health system managers, it can help monitor programs and inform decision-making, policy, funding, and more. Increasingly, our partner countries are undertaking efforts to transform their paper-based health systems to those enabled by digital to accelerate efforts towards achieving Sustainable Development Goal 3, which is aimed at ensuring healthy lives and well-being for all. When investments in digital health are strategic and coordinated, they contribute to broader socioeconomic development and can strengthen country health systems. When investments in digital health are not strategic or coordinated, they can lead to challenges with data fragmentation, unsustainable systems, and increased administrative costs and burden. USAID has made significant contributions to the digital transformation in partner countries, but much work remains. Through the new digital health position paper, USAID is recommitting to shifting our investments towards more coordinated, sustainable, and interoperable digital health solutions and mitigating known implementation challenges by advancing the whole of the enabling environment. The digital health position paper recommits to the 4 strategic priorities identified in the vision for action in digital health. The first, assessing and strengthening a country's digital health enabling environment, is focused on understanding the current landscapes, the gaps, and the priorities across the interrelated building blocks to help direct USAID's funding and support appropriately. The building blocks include policy, workforce, governance, strategy and costing plans, infrastructure, standards and interoperability, as well as applications and solutions. Next is aligning digital health investments to national digital health strategies. Where countries do not have existing strategies or they need to be refreshed, we can provide support. Where they exist, USAID is moving to align investments in support of these strategic plans and priorities. The third is supporting plans and development of technical specifications for national digital health architectures, and then aligning our investments to support their implementation. With our fourth strategic priority, we are continuing to invest in and encourage the use of global goods, including proven open source software solutions that are configurable to different countries, programs, and contexts, and enable local partners to build on top of these solid foundations. The Digital Health Position Paper also presents 6 practices that convey our key learnings identified through country implementations and provide further guidance to agency staff and partners on how to strengthen investments to meet country needs. In the 4 years following the launch of the Digital Health Vision, across the globe, we saw changes in the landscape, challenging ones like COVID-19 pandemic, new conflicts, increasing climate shocks, and rapid technology shifts, like the evolution of artificial intelligence tools, the growth of digital public infrastructure, and the wide adoption of standards. We've learned a lot from our experiences and the evolving landscape which we have directly shaped these new practices. Practices include, first, committing to person-centered point-of-care digital systems. This includes looking at shifting funding towards individual patient-level systems and reusing the data created by those applications for other purposes, such as M&E. And it's an opportunity to further engage individuals in their care through the use of digital tools. Second, requiring data standards to enable integrated health service delivery at scale. This aligns with our architecture strategic priority and brings more attention to the critical role of data standards like FHIR that are necessary to enable data exchange for whole countries' health systems. Third, support country-led governance of health system digital transformation. It's essential that countries are at the helm owning their digital transformation journeys and that we're working in lockstep with them to coordinate around their vision, priorities, and needs. While we emphasize the strategies and the architecture and our priorities, the governance is the critical element that enables those 2 plans to actually come to fruition. Fourth, we know we need to put greater emphasis and help countries strengthen their data privacy and cybersecurity practices. There are a lot of opportunities to align them with global guidance and support country policies to protect individuals' data and prevent harm. Cybersecurity is growing to be a larger and larger priority in most of the countries you work in, and it's something that we cannot just avoid spending time, money, and energy on. Fifth, we aim to deepen engagement with local partners, including the private sector. We are recommending greater investments in building local capacity, supporting economic growth, and supporting local innovation on top of global goods, and cultivating partnerships with these types of entities. If these solutions are going to be sustainable, they're going to be developed and maintained locally. And finally, sixth, we will continue to invest in shared resources that advance the global digital health commons. We will continue to draw from and further contribute to strengthening these commons and communities, including by investing in global coordination initiatives and regional networks. This guidance is critical to ensure our global health investments are strategic, sustainable, and aligned with the priorities and planning of USAID's partner countries. Adele, I'll now turn the floor back over to you.
Excellent. Thank you so much, Merrick, for walking us through what's in this digital health position paper. As you can see, we're trying to take a thoughtful and strategic and nuanced approach with the document, thinking well beyond individual tools and more about how, at a systems level, USAID can be the most effective partner we can to the countries that we work with as they move through this complex and multi-year journey of digitally transforming their health systems and their health sectors. So now, to take us a little bit closer to the ground to see what this can look like in practice, it is my pleasure to turn the floor to our colleagues in the USAID Kenya and East Africa office. We'll hear from Bradley Cronk, who is the Health Office Director, Peter Yagon, who is Deputy for the Health Analytics Team, and then Washington Omwomo, who is Health Analytics Team Lead. And Bradley's going to help set the stage by talking a little bit about USAID's work in Kenya. So Bradley, I'm going to turn the floor over to you. Thanks so much.
Thanks, Adele. Yes, I'm Brad Kronk. I'm the Health Office Director here at USAID Kenya East Africa Mission. Thanks again for the opportunity to showcase USAID Kenya's work in the digital health space. We're very excited to share how our work aligns with the USAID Digital Health Position Paper's priorities and practices. So I'll just be brief and just provide a bit of context, but mainly I'd like to hand it over to our technical team in a couple moments. So anyway, USAID Kenya has been supporting the Kenyan Ministry of Health in its digital health programming for years, providing technical assistance at the national level. With the Kenya 2010 Constitution, our support is now layered at national and county levels. There's been a number of legislative actions over the past few years to strengthen digital health, codifying the need for a unified and integrated health information system. In October 2023, Kenya enacted the Digital Health Act, which established the Digital Health Agency, as well as formalized the implementation of the Digital Health Superhighway, which is often referenced here. It's a comprehensive digital health infrastructure, which includes a national health information exchange to allow for the secure flow of electronic information across the healthcare system. Also, in October 2023, the Primary Healthcare Act was enacted, providing a framework for the delivery of, access to, and management of primary healthcare. This has been operationalized through the establishment of a hub and spoke model primary care, through the establishment of hub and spoke primary care networks, or PCNs, and the rollout of an electronic community health information system, ECHIS, in all 47 counties. USAID supported PCN establishment in 25 counties and ECHIS rollout in 26 counties, and has gone further to partner with MOH in the deployment of smart PCNs, which are digitized versions of PCNs with bidirectional referrals between the community and facility. We're scaling this model in the 7 primary impact counties as MOH plans on country-wide rollout. This is what Atul was referring to in his opening remarks, what he had seen personally. So finally, USAID Kenya has developed a flagship digital health activity, Kenya Digital Health Ecosystem, KDHE, whose overarching development objectives fully align with the agency's digital health white paper. The Kenyan mission looks forward to developing a meaningful collaboration and strategic partnerships to support Kenya's health sector digital transformation through KDHE. I will now hand it over to Peter in Washington to share some examples of how our digital health investments align with government priorities and with priorities and practices identified in the digital health position paper. Thank you again.
So thank you for the opportunity to discuss the Kenya digital health landscape. It is exciting to note that the Kenya Ministry of Health vision is well aligned to USAID digital health position paper priorities and practices. We will use this infographic to present our architecture and discuss how USAID Kenya is supporting the realization of this vision. The Digital Health Superhighway represents Kenya's health information exchange architecture. It was jointly developed by the Ministry of Health, USAID, WHO, CDC, DOD, and other stakeholders in a convergence workshop. Some of the digital health solutions in the superhighway are fully developed, while others are still work in progress. Let us start this discussion with the health information exchange resources highlighted with a cycle on your screen. The foundation of our architecture is the interoperability framework with the Ministry of Health enforcing standards-based development. This is in line with the DHPP recommended practice of requiring data and information standards to enable integrated health service delivery. In support of the ministry vision, USAID and stakeholders provided technical and financial resources in the FHIR standards training and implementation. Additionally, we have supported health information system exchange resources, that is the client registry, the health care worker registry, the Kenya Health Master Facility List, the shared health record. I will highlight just a few of these given time constraints. That is the Kenya Health Master Facility List, or KHMFL, and the client registry. Kenya Health Master Facility List enables unique identification of facilities that provide services. It is the single source of truth on facility information, that is geolocation, level, ownership, and services provided. USAID Kenya supported the design and implementation of this registry, that is the Kenya Health Master Facility List Registry. Through the PEPFAR program, US government agencies, that is USAID, CDC, and DOD, provided technical inputs in the development of the client registry, which has since been adopted by the Ministry of Health. These two, that is the Kenya Health Master Facility List and the client registry, are critical for portability of client records through the ecosystem. Some of the common services that you see, like the digital claims and telemedicine, which you see on the right of the cycled area, are in nascent stages of development and deployment. Now, next. Now on the next slide, the cycle that is highlighted on the left on your screen, we'll talk about the point of care systems. Kenya utilizes a suite of global goods like the Open MRS and the Community Health Toolkits. I will highlight on 2 point of care systems. That is the Kenya EMR and the Electronic Community Health Information System that was mentioned earlier by Dr. Atul. Kenya EMR is an Open MRS-based digital solution that is facility-wide, client-level point of care system. The system was initially developed for the PEPFAR program under the leadership of Palladium Kenya, funded through CDC. This system has now been expanded to support the complete patient journey with clinical and administrative modules that monitor client outcomes and serve the facility admin needs. The expansion of Kenya EMR was a US government joint effort between CDC and USAID. That is making sure that the health information partners were brought together to work on this system as a unified facility level, client level system. Now, this Kenya EMR is a USG success story. It is now one of the systems that has been certified as part of the Kenya digital health ecosystem. It is interoperable with ICHIS, that is the Electronic Community Health Information System, which is an Android-based community digital solution built on the open source CHT platform. The development of Kenya EMR is being coordinated through a community of developers from the USG HIS implementing partners. ICHIS is used in the community by the community health promoters to collect and report data from the community. The interoperability with the facility level EMR allows for bidirectional referral between community and facility. The implementation of these two solutions, that is Kenya EMR and ICHIS, has been supported by USAID Kenya and USG agencies and are well aligned to the DHPP recommended practices of committing to point of care digital systems and priority of using global goods. Now, moving to the next part of the discussion, on the right-hand side of your screen, we will now shift focus to strategic partnership. We start with the government of Kenya agencies and partners, the private sector, and the stakeholders collaborating in the digital health ecosystem. All the strategic partners are shown on the cycle that is highlighted on your screen. Allow me to focus on the last item that is shown there, that is the academia or the universities and other academic institutions. They form a core part of our strategic partnership model for sustainability of health information systems investments at the national and county levels. They support workforce development or workforce capacity building through tailored professional training, a community of practice, localized technical support, service level agreements, and other digital health engagements at county level. The universities also have linkages with North American universities for North to South learning and exchange of global best practices. Additionally, USAID has partnered with MEDIC, which is a private sector entity, to develop and deploy the electronic community health information system. Through our partnership, USAID Kenya is deepening our engagement with local partners and aligning with the DHPP priority of strengthening the country digital health enabling environment. Our fourth area, which is highlighted on your screen, that is the national ICT infrastructure, is a key component that is required for realization of the digital health superhighway. The government of Kenya, working with the private sector, are supporting the fiber network connection to county level referral facilities and the supply of tablets and GSM internet connection or capabilities to primary care facilities. These are the level 2 and level 3 facilities. The government of Kenya investments have built on lessons learned from past USAID ICT infrastructure support. Government of Kenya investments on infrastructure is a great example of partnership between the governments and development partners towards a sustainable common objective. Lastly, as you can see on that screen, we have the enabling environment. So governance, regulations, the Digital Health Agency certification of digital solutions against the set standards, the continuous monitoring and learning and adaptation provide an enabling environment to support the digital health ecosystem. USAID has supported multiple government initiatives, including the development of the Kenya Health Enterprise Architecture, the Data Governance Framework, and the Unique Patient Identifier Framework, which form the foundation of the client registry, which has been deployed by the Ministry of Health. Now, lastly, this is a site visit or an example of a smart or digitized primary care network site visit in Kenya in November 2023. This was mentioned earlier by Dr. Atul during the opening remarks. I will now pass this to my colleague Washington Omomo, who will talk about lessons learned and next steps. Thank you.
Good morning, good afternoon, good evening. I'm Washington Omomo, currently the Health Analytics Team Lead here at the mission. So we have so many lessons that we've learned so far, but given time, I only want to single out one. So when USAID started working with the Ministry of Health, way back, we only had within the Ministry of Health one HMIS office, which was staffed by one person. And we engaged with the leadership of the ministry, and that one office was then transformed into a division with the HMIS, M&D, and research departments. And because we continue to engage with the ministry leadership, even during the different administrations, this division ultimately was transformed and or upgraded to a directorate with the digital health, health financing, and innovation divisions, staffed with the adequate staffing and the appropriate skill mix. So we see that given where the investment that USAID has had in this institutional capacity building, the directorate actually was so critical in spearheading the digital health for highway work or policy that the current administration has. And it worked very well in stewarding the digital health transformation in Kenya, even as the government was enacting Digital Health Act and ultimately creating a digital health agency. All this align very clearly, very well, with the DHPP priority of enabling environment and the strategy, as well as alignment of national investments with the national strategies. In terms of practices, I think the institution that we helped build in the country, particularly within the Ministry of Health, again aligns very well with one of the practices, which is country-led governance and also investing in local partners. Now, I think given the lesson we've learned at the national level and Kenya being health sector in Kenya being a devolved function, we have prioritized that in the next phase of our support, we are going to prioritize strengthening institutions and human capacity at the county level, because it is very clearly clear that with the investment in institutions, we'll be able to sustain this investment at the county level. Now, what we are going to do now as part of the next steps, we have today actually an award was announced, the Kenya Digital Health Ecosystem, a 5-year award that runs from 2024 this month to 2029. And the key strategic objectives are on integrated one national HMIS. The next objective is on vision, policy, and strategy. Then the last one is strategic partnerships and collaboration that focuses on the academia, private sector, the think tanks, the national government, and other digital health tech giants at the global, regional, and country. So we are going to embark on now co-creating, having a meaningful co-creation with the national stakeholders led by the Ministry of Health, and then we'll come up with a framework of joint implementation, outcome monitoring, learning, and adapting. We are looking forward to establishing a very close and meaningful collaboration with the Bureau for Global Health so that we can enhance the learning and be able to scale up best practices within the digital health programming here in Kenya, but borrowing and learning more from the Global Health Bureau and also other countries that the Global Health Bureau is supporting. So we are looking forward to this work, and I think we are at an exciting time in Kenya because our new activity, which is KDHE, fully aligns with the DHPP priorities and practices. And we think that if you look at the priorities, the government of Kenya again fully aligns with the government of Kenya priorities. So we hope to transform this country using KDHE, close collaboration with the Global Health Bureau and other stakeholders at the international arena. Thank you very much, and back to you, Adele.
Thank you so much. I love this story. It is such a compelling example of what's possible with strong government leadership and strong and sustained partnership from USAID together with other agencies and a broad variety of other stakeholders, as you mentioned. So thank you, Brad, Peter, and Washington for that presentation. And now we're going to look at another country that has an ambitious digital health vision, and that's Indonesia. And I'm thrilled to turn the floor now to our USAID Indonesia colleagues, Daryl Martiris, the Deputy Health Office Director, and Anastasia, or Anas Susanto, who is Health System Strengthening Team Lead. Daryl's going to walk us through USAID's digital health work in Indonesia at a high level. And Daryl, the floor is yours. Thank you.
Thank you, Adele. Can you hear me okay?
Loud and clear.
Great. So thanks for the opportunity to speak about USAID Indonesia's health portfolio and the strategic role of digital health in advancing our work here. So you can see in the slide that Indonesia, just amazingly diverse, vast country with great connectivity, 212 million internet users in Indonesia out of a population of about 275 million. 1.6 million plus healthcare workers, serving 60,000 plus health facilities in 17,000 islands, and 400 plus health information systems, many of which are redundant or duplicative. So our partners in the government of Indonesia have an ambitious vision for the integration of digital technology to strengthen health systems and improve health outcomes. We are fortunate indeed that we have an incredibly dynamic Minister of Health, a former investment banker, no less, who we've had the pleasure to work with for the last few years and will continue to do so in the immediate future or the near future. In particular, the Ministry of Health has set a target of digitizing all medical records by June 2024. They've achieved more than 80% of that goal, in the sense that over 80% of public primary healthcare centers are connected and sending data using an EMR. It's not all public health centers, because there's also quite a few private ones, but 80% of the public ones are now connected. And that's an achievement, a significant achievement. The data in these records are interoperable also through the Satu Sehat interoperability platform that the Ministry of Health has set up. Now, government leadership through policies and legislation is critical to drive strategic national digital health transformation in Indonesia. And we will cover this as well in the presentation in a few minutes. USAID is pleased to partner with the government of Indonesia to deliver on this ambitious agenda. Our primary mechanism of doing so is our digital health flagship, CHISU, which provides TA to the Ministry of Health, and which also helps to coordinate the digital health work of our existing vertical programs in MCH, TB, HIV, and global health systems, and global health security, sorry. So I'm now pleased to turn the floor to Anastasia Susanto, or Anas, who is leading the work with our in partnership with our other development partners and our implementing partners. So Anas, over to you.
Thanks very much, Paderl. So I want to start with the digital health position paper priorities. So if we go to the next slide, we see the 4 different priorities that have been outlined in the digital health position paper. So the digital health enabling environment, the national digital health strategies, the health architecture, and also the use of the global goods. And the next slide will show you how we use them in practice for the activity we have in Indonesia. And so for example, on the enabling environment for the first one, we helped Indonesia establish a digital maturity index, adopting the health information system stages of continuous improvement toolkit to align with Indonesian context, and we use it to assess the HIS maturity level at the national level, subnational level, macro and micro level at the facility. I will elaborate a little bit on this in the next slides. And then the next one is we work to support the national policies and strategies that drive digital health transformation. So USAID supported the first digital blueprint that Indonesia had, and we worked to implement our program in alignment with the blueprint as well. And we are currently supporting the development of the next one, the next digital health transformation strategy for 2025-2029. Now, on the global goods, for example, Indonesia, we use global goods to accelerate the digital transformation agenda, in particular for interoperability between electronic medical records and within the health information exchange architecture. So we use interoperability standards such as HL7 FHIR, medical terminology such as ICD-9, ICD-10, LOINC, SNOMED, and key references such as the WHO digital adaptation kits. What are all these standards used for? We use them to actually accelerate the process of developing and applying data standards to information system. And these standards that are used, allowing different systems to now speak with each other. They can now speak different language and different interfaces, different platforms. So if you, I think in another word, it's serving like a Google Translate. So by using this global standards, global goods, we save time, not to reinvent the wheel, but meeting international standards to ensure data quality as well. And then the next one is the digital health architecture. We help to build a clear pathway, a clear workflow. So the way we do it in Indonesia is we define what the use case is, so define what the disease we want to prioritize, what the components are. I will elaborate a little bit on this later. And then we develop the data standards, establish the interoperability guidelines, and also work on the data privacy and data security. Now, the next slide, I'll show you a little bit on what we identified based on the enterprise architecture, this is how we map our work. And I want to highlight the one underneath, which is the cross-cutting on governance. So Indonesia leadership in digital health transformation in the country is key to the progress that we have been making. So there has been a lot of government regulations, presidential regulations, which lay the foundation to create a unified, secure, and also accessible national health infrastructure and architecture in the country. And USAID work focuses on building and reinforcing this governance framework to ensure that our investment align with national priorities so that we have a sustainable and scalable system improvements as well. Now, moving on to the practices, in the next slides, you'll see the 6 different practices outlined in the digital health position paper. Next slide, please. And in this presentation, I want to focus on, in the next slide, you'll see the 3 different focus that we will focus, which is the data standards, governance, data privacy, and cybersecurity practices. So next slide. Yeah, these are the 3 that I will be focusing specifically. Next slide, we'll start with the data standards. So for TB, like what Paderl mentioned earlier, we work on establishing the standards for TB. So we work on 4 different components of TB services and establish data standards for each of those components. And I want to highlight the section on the right side, which is the business process for TB services. So we, with establishing the standards for TB, we also at the same time establish a business process, and that creates us a clear pathway for everybody to understand what the process looks like and enable that to be translated into the application, to the system, to the electronic medical records later on. So if you see here, we have 4 different standards for TB on patient registration, for a person with TB symptoms, the lab, and the treatments and the medications as well. Now, the next slide, I will focus and highlight on the governance of it. So if you see how we've been using the standards, allowing us to move from multiple applications into just one. So if you see at the top, before we have to fill into at least 2 systems, the electronic medical records and the TB information system. Now we just have to fill into one information system, which is the electronic medical records. So we were able to reduce half of the time that's needed to enter the data. And this allows us to have a real-time data, improve speed, accuracy for diagnosis and treatment decisions as well. Now, the next slides, I will talk a little bit on the Digital Maturity Index. So another success in this is we are able to help Indonesia adopt the Digital Maturity Index, implemented in 151 provinces and more than 1,500 hospitals. And if you see here, the spider web, it allows us to identify where we were. So you see we did this in 2022 and then another one in 2023. We were able to see where the baseline is and identify priority areas such as like the data security or the standards or data analysis, and work towards a goal where we have every component strengthened. Now, the last piece I want to focus on is the data security. In the next slide, you'll see a data life cycle on HIV. So we work to map out first what is the data life cycle looks like for HIV. So we know that the data passes through several stages from collection, processing, storages, up until the use of it. And based on this mapping, we are able to identify what, the stages where it's very vulnerable, for example, and allows us to secure and do safeguards to limit unauthorized access and risking patient confidentiality. And with that, I would just want to conclude that the lessons learned we had from our experience in the country is that digital health transformation require a strong country-led governance. And Indonesia will continue to support the Indonesia government to strengthen and deepen its digital health transformation moving forward. So with that, I'll hand it back over to Adele. Thank you.
Great. Thank you so much, Daryl and Anas, and to all the presenters for sharing your insights and experience with us as part of this webinar. And now we've got almost a full 10 minutes left for Q&A. So thank you to everyone who has been putting questions in chat. I'm going to try to bundle some of the themes together, and I'll take two at a time and ask our speakers to just give lightning responses so that we can get to as many of the questions as possible. And I'm going to take moderator's prerogative and direct the first question, Atul, to you, if that would be okay. And that is to ask you what your vision is for the future of global health and how you see digital playing a role in that vision for the future. So Atul, if you're available to answer, please come back on camera. And in the meantime, I'm also going to direct a second question, Kenya team, to you guys. So we've had a number of questions that have come in chat related to localization, related to capacity and standards. And there was one in particular that looked at the nexus of those three different themes and was asking how you are taking the experience of LMIC, low and middle income country implementations, to ensure that whether it's standards or other approaches to digital health transformation, that these are informed by the communities where the work is being done. So Kenya team, I'm going to come back to you in just a second to ask you to answer that, but Atul, in the meantime, over to you. Thank you.
And what was the question? Forgive me,
Yeah.
I didn't catch that.
That's quite all right. I was asking for you to share some reflections on your aspirations for the future of global health. You've had a large focus on primary healthcare, for example, and how you see digital transformation playing a role in that future. Thank you.
Yeah, so the bottom line of our work at USAID is we have two core objectives. I think they're wrapped together. One is that we want to reduce inequities in life expectancy overall, and we're taking as our kind of top line target reducing mortality, the percentage of deaths in a given country that occur before the age of 50. It starts with children, but then goes all the way up to people in young adulthood and middle age. And as we do that through our programs, we want to build the systems that enable ultimately lifelong care. And the reason to have emphasized primary care is roughly 3/4 of what is required to reduce mortality is going to be delivered through primary healthcare systems. But if you take the larger view, there is primary healthcare systems, there are some referral and secondary care capabilities, and then hospital-based care like emergency rooms and surgical services for C-sections and so on. Information is the lifeblood of making those goals successful. And if we're going to have success, the reason why programs keep investing in strengthening their digital health architecture is that it's such a vital tool. It's the only way you recognize the gaps, whether it's stockouts or poor quality of care or successes, what services are being provided, and then be able to offer solutions that continually improve in making those areas of delivery. It provides the information links that makes it so a person's experience is seamless in the system, and it enables the clinicians and other providers to actually be able to understand what the situation is of the people they care for and be more effective. So throughout our work, whether it's around safety, quality, and improving essential coverage of services, we won't be able to do without these systems. We've lived through a major transformation going from applications to really platforms like I described. And now it's this chance to be able to use those platforms to bring in, whether it's financial payment systems, being able to connect services, and ultimately apply artificial intelligence in ways that enable specialty capability at the primary health level. It's an exciting period coming up in the next decade. And I think there's going to be only more desire to lean into these systems and to make sure and help work with countries to make sure they're not left behind.
Thank you so much, Atul. It's helpful to keep this work grounded in the health need, and that was a really nice overview of the opportunity we have before us and this compelling rationale for why we need to take digital transformation seriously and approach it strategically in order to unlock these benefits as you've described. So I think we're going to have time just for one more question, and Kenya team, I'm going to hand it back to you. But in doing so, I'll take this opportunity to flag for everybody. I think many in this audience are probably already aware that our annual forum and meeting that collects many of us together will take place again in just a few weeks in early December in Nairobi, Kenya. It's the first time the Global Digital Health Forum is moving outside of Washington, and we're thrilled to be heading to Nairobi, Washington, and team to be meeting with you in person there and hearing from the government and other representatives about the work happening there. So I just wanted to make the link to that forum where we will be continuing this discussion among others. And Washington, if you could just help close us out with an answer to this question about the nexus of localization and government ownership and how you see it from the USAID Kenya office perspective. Thank you so much.
So thank you very much, Adele. So to take that question, I think the question on the chat was really how the top-bottom approach is being approached so that there are exchanges between the local actors and the international actors, and also how the government of Kenya is coming in and maybe the beneficiaries. So one way of looking at this is when you talk about the Kenya digital health space, it is really government-led. The Ministry of Health is really leading the interventions and making sure that any priorities that are put forward are aligned to the government priorities, and they provide that kind of leadership. I think in 2019, we rolled out the Data Protection Act. This is an example of an act that was rolled out in Kenya way back before the digital position paper came out. And this Data Protection Act was really to make sure that the information that will be exchanged, because I think there was a foresight that exchanges will be happening in future, is really secure, so that we are securing this data and making sure that the client has a responsibility on what data can be used and for what purposes. The other example that we have is in 2010, we did come out with the EMR standards and guidelines just to guide the electronic medical record systems that we were rolling out in the HIV space. In terms of the global forums that we have been able to engage with others on these particular standards and be able to exchange ideas is through the country operation plans that are held on the PEPFAR side. Of course, we have also had several regional exchanges between the countries in the region just to talk about the digitization and the digital health standards. Additionally, when you look at the Digital Health Act 2023 for Kenya, this really emphasizes the fact that you need to have an integrated digital health solution. You need to be person-centered, or making sure that the person is at the center of the development that we are doing, and any development, any systems that will be deploying have to meet standards. That is why the Digital Health Agency in Kenya will be certifying any digital health solutions that will be rolled out in this space. So that shows leadership on the government side. And also these exchanges with our HIS backstops and these other colleagues at the international space is really infusing into that kind of development in Kenya. Just to mention about the local universities, we have what we call the county proximate universities. This is really devolving the support that we are providing on the health information system space, since healthcare is devolved in Kenya. So we rely on universities at a national level, but also county level universities, so that in certain regions, you are really getting support from regionalized universities. Thank you, Adele.
Thank you so much. That was a wonderful and comprehensive answer to a question you just got posed on the fly. I really appreciate that. So we are at time. A huge thank you to everyone for joining us, to our speakers for their presentations, and looking forward to continuing the collaboration with all of you in the weeks and years ahead as we embark on this journey to continue to deepen and strengthen our support to countries as they move through this process of digital transformation to improve health outcomes and health equity for all. So thanks again to everyone. Here's a link on the screen where you can find more about USAID's digital health policy documents. And to those who are planning to attend the Global Digital Health Forum in Nairobi, we look forward to seeing you there. Thanks so much, everyone. Have a great day.